Now, for a long time, lifestyle diseases such as cancer were more likely to be found in the developed world, while poorer countries had a bigger burden of infectious diseases. But that's changed in Kenya. Africa's sixth largest economy has only 20 oncologists, doctors who specialise in cancer. Yet more than 40,000 Kenyans are diagnosed with cancer every year. BBC Africa's health correspondent Anne Soy went to the country's national hospital to find out how they're managing.
Children battling cancer at Kenya's top public hospital, Kenyatta. They have a reason to sing about their joy. They are among very few cancer patients who have been admitted to the limited specialist health facilities in the country.
Mkiniangalia mnaona dalili ya mgonjwa.
Rose Chendo, a survivor, is here to encourage them. She knows all too well the challenges of getting cancer treatment in Kenya. She was diagnosed with cervical cancer in November 2013.
It took me like 2 months before I was able to get a chance to go to theater for a further investigation. When I went to Kenyatta Hospital, there were so many people. The queue was very long, and so sometimes you could go there, spend the whole day, only the time ends, because you know, of course, they work with time. When the time comes to close, it's time to close.
This is the third cancer treatment equipment to be acquired by the hospital. There are only 10 such machines in the country. 7 of them are in private hospitals. Yet more than 14,000 Kenyans are diagnosed with cancer each year.
It may develop into a waiting list. And 2, the available resources are stretched, leading to overuse of the equipment, and that also translates to frequent breakdowns.
The ever-rising number of cancer patients in the country is putting a strain on the health system, especially in the public sector. And hospitals like Kenyatta can simply not cope with the numbers. And for that reason, some patients have opted to go out of the country for treatment.
Even now with...
Kevin Mochiro is scheduled for a bone marrow transplant in India. The former BBC correspondent was recently diagnosed with multiple myeloma, a cancer that affects blood plasma cells.
The doctors here aren't familiar, haven't done that many procedures like this. We're looking at different options, but the costs were prohibitive. I mean, we're going to charge almost $20,000 for a week's pre-operation examination. And that is the cost of just my surgery in India.
Many Kenyans are now keen to learn more about cancer. Hospitals like Kenyatta organize events to create awareness. Faced with limited resources to treat the disease, they emphasize prevention. Anne Soy, BBC News, Nairobi.